What are the alternatives to buprenorphine patch? If you are considering options for addiction treatment and wondering what alternatives exist to the buprenorphine patch, you are in the right place. Buprenorphine is a medication used in medication-assisted treatment for opioid use disorder. While the patch is one way to receive this medication, there are several other alternatives worth exploring. First, let's talk about methadone. Methadone is a full opioid agonist, meaning it activates opioid receptors in the brain fully. This medication has been used for decades in specialized clinics to help people with opioid addiction. It can effectively reduce cravings and withdrawal symptoms. However, methadone requires daily supervised dosing at a certified opioid treatment program. This can be a challenge for some individuals due to the need for regular visits. Another option is naltrexone. Naltrexone is an opioid antagonist, which means it blocks the effects of opioids. It comes in two forms: oral tablets taken daily and an extended-release injectable form given monthly. Naltrexone is non-addictive and does not cause physical dependence. It is a suitable choice for individuals who have completed detoxification and prefer not to use agonist therapy. However, it is essential to be opioid-free for a period before starting naltrexone to avoid withdrawal symptoms. Then, there are sublingual and buccal formulations of buprenorphine. These are taken under the tongue or inside the cheek and are often combined with naloxone to deter misuse. These forms of buprenorphine are flexible and can be prescribed in office-based settings, making them more accessible for many patients. Additionally, buprenorphine is available in other forms, such as sublingual tablets and implantable devices. The choice of which form to use depends on personal preferences and clinical needs. Beyond medication, there are non-medication approaches that can support recovery. Behavioral therapies, such as counseling and cognitive behavioral therapy, are often used alongside medications. These therapies can help individuals develop coping strategies and support their recovery journey. Peer support programs like Narcotics Anonymous also play a vital role in recovery. These groups provide social support and accountability, which can be beneficial alongside medical treatment. When considering alternatives to the buprenorphine patch, it is essential to think about personal preferences and needs. Some individuals may prefer not to use opioid agonists like methadone or buprenorphine due to past experiences. Naltrexone offers a non-opioid option but requires full detoxification first. Access to treatment is another important factor. Methadone is only available at licensed clinics, while buprenorphine and naltrexone can be prescribed in various healthcare settings. This can affect which options are practical for different individuals. Safety is also a consideration. Methadone and buprenorphine have a risk of misuse and requiring careful monitoring. In contrast, naltrexone does not carry this risk but may not be suitable for everyone, especially those not fully detoxified. In summary, the main alternatives to the buprenorphine patch include methadone, naltrexone, and other buprenorphine formulations. The best choice will depend on individual situations, preferences, and access to care. All these options are most effective when combined with counseling and support services.